Good evening, good afternoon, good morning to you, wherever you're joining us from. Welcome to the final 2024 edition of Neurology for Vets live webinar journal club, sponsored by Hallmark Veterinary Imaging. As you may know, during these webinars, we hear directly from the author of a recent clinical neurology study about the reasons for the study, how it was conducted, and what are the findings. Today, we are very honored to welcome Dr. Nick Grapes, another rising star of the profession, who is going to talk us through his publication, and it's titled Prevalence of Discospondylitis and Association with Congenital Vertebral Body Malformations in English and French bulldogs. Now, we don't want to pick a fight between English and French or pick on the Frenchies, but today it's a perfect opportunity to welcome my colleague, Dr. Laurent Grossi, as well as Dr. Grace.
The French one.
For those of you who don't know. Moving on quickly, let's tell you a little bit about our guest today. Nick graduated from the Royal Veterinary College in London in 2015. Then he spent 3 years working in a small animal practice in Newbury, Berkshire, England. Thereafter, he returned to the Royal Veterinary College to complete a rotating internship and a subsequent 3-year residency in neurology and neurosurgery. Became a diplomat of the European College of Veterinary Neurology in 2023. Nick currently works at Davies Veterinary Specialists in England, having joined the team during the summer of 2022. Nick has already written multiple impactful studies, which are addressing the likes of disc disease, discospondylitis, and clinical reasoning for neck pain in dogs and vestibular disease in dogs. So Nick, thanks very much for joining us. Really appreciate it. Appreciate you giving up your time to discuss this study. Welcome to the webinar, and I'm going to turn things over to you.
Thank you very much. Hopefully the technical difficulties will have resolved. So you may have to bear with me somewhat. I assume that we all go back to the beginning. If it doesn't work, Laurent, I wonder whether you might be able to flick through the slides at the appropriate interval if you have.
I've got no control on your slide. Yeah, so here we can see the presenter view with the text.
Oh, fine. Let's go back to the.
Perfect. And if you flick to see, make sure you can flick through.
Do you see it moving or not?
No, it's not moving.
No worries. We'll go to plan B, and I will try and have my note elsewhere. Good evening, everyone. Thank you for joining us this evening. Firstly, thank you to Laurent and Simon for inviting me to share with you our recent publication, the title of which Simon has just gone through, and you can see it on the screen. And also, secondly, a massive thank you to the co-authors who contributed to this publication. We'll start a little bit with a summary of discospondylitis, as I'm confident that everybody probably watching will be aware that discospondylitis is an infection of the intervertebral disc and associated vertebral body endplates. This infection is most commonly bacterial, but can also be fungal, particularly in certain parts of the world, with the most prevalent or frequently identified bacterial cause being Staphylococcus intermedius. Hematogenic spread is generally regarded to be the most common source of infection, but migrating foreign bodies are also reported amongst other causes. The theory being that the infection spreads via the bloodstream and becomes then lodged within the highly vascular and slow-flowing metaphyseal and epiphyseal capillary beds, with then rapid spread into the associated intervertebral disc. As you can see, large breed middle-aged dogs are generally predisposed, with males typically outnumbering females in most publications at a ratio of around 2 to 1. Generally, it's regarded to occur most commonly at sites of the vertebral column in which there's a greater level of mobility, with the L7S1 intervertebral disc space generally being most commonly affected, then with higher incidences in other regions such as the mid-thoracolumbar region and also the caudal cervical region. So this condition can be challenging to diagnose in some instances, because we know that the signs can wax and wane within their ability. Sorry, my notes have just disappeared. Let me just get those back. Perfect. And the most common clinical signs are often spinal pain, with previous publications reporting up to spinal pain up to 80% of cases. Associated with this, we can have some degrees of lameness, exercise intolerance, signs of systemic illness, for which pyrexia generally can occur in a variable number of cases, but often reported to be around a quarter to a third of cases. And then we can also have the aspects of neurological signs occurring. However, typically these will need to be predisposed by either a pathological fracture or luxation, or a secondary empyema occurring, rather than purely being the result of the discospondylitis itself. Previous studies also looking at the changes that we can see on our blood panels have shown that leukocytosis can be present in up to 50% of cases, and the vast majority will have elevations of their CRP if we test for that. So in terms of diagnosis, this can be achieved radiographically. However, we know that CT or MRI would often lead to diagnosis earlier within the disease process. Generally, some older studies reported that the radiographic clinical signs may well lag behind the clinical signs within the patient by about 4 to 6 weeks. The imaging features of radiography, MRI and CT have been well defined previously within the literature, typically including changes to the endplates, intervertebral disc, and often in the modalities of which we give contrast, associated contrast enhancement of both the disc, endplates, and surrounding soft tissues. And it's these previous publications which we used in order to recruit our cases that had CT and MRI imaging. Generally, we'll then look at identifying or attempting to identify a potential cause of hematogenous spread by isolating infection elsewhere in the body. This may be done with urine and or blood culture, sometimes echocardiography, and sometimes brucella serology might be considered. And occasionally we'll also, if safe to do so, look at doing percutaneous needle aspiration of the disc to gain a sample for culture and sensitivity. Treatment, of course, is provided it's bacterial, generally antibiotic based, ideally based on culture and sensitivity results, and often we require a long course of treatment in these patients, with up to 53 weeks reported in some older studies. Here's just a nice example of a case that we had as part of the study that we're going to discuss earlier, with T1 weighted sagittal MR images showing pre-contrast in the top left and post-contrast in the bottom right image there, showing the degree of changes that we see in these patients in contrast enhancement. So moving on to look in a little bit more detail about congenital vertebral body malformations, which is of course the other area of interest from the study that we're going to discuss. So we know that congenital vertebral body malformations are common within the brachycephalic screw-tailed dog breeds, such as French bulldogs, English bulldogs, Boston terriers, etc. It's been suggested that the presence of hemivertebra and such like within these breeds is the result of the desirability to breed in a small curled screw tail within to the coccygeal region of these breeds, and that has then led to the presence of these hemivertebra and malformations elsewhere within the vertebral column of these dogs. These patients or dog breeds certainly becoming increasingly popular, I think, in pretty much any country worldwide. And as you can see here, I think this is taken from the AKC, but we've also got a similar occurrence recently here within the UK as well, that they're becoming increasingly popular, with actually French bulldogs, pugs, and English bulldogs being reported within the top 10 most popular breeds of Kennel Club registrations within the last 4 years. So why do they occur? Well, the pathogenesis generally is yet to be fully established. However, a lot of studies are reporting a multifactorial etiology. There have been studies, as you can see on the screen, that have identified a gene that's known to be associated with the presence of these malformations. So the DVL2 or disheveled 2 gene is known to play a role and has been linked with the development or presence of thoracic and or caudal malformations of the vertebral column in English bulldogs, French bulldogs, and Boston terriers, but importantly, not pugs. And therefore, we tend not to group pugs in generally as a screw-tailed brachycephalic breed as a result. So within people, autologous frameshift mutations of the DVL1 and DVL3 genes have been known to cause, or are reported to cause, a syndrome called Robinow syndrome, which is a congenital disorder of people characterized by similar craniofacial, limb, and vertebral malformations to those that we see within these dog breeds. You can see here on the right a quite dramatic malformation taken from a human paper. So generally within the human literature, congenital vertebral malformations have been subdivided and categorized, usually on the basis of their radiographic appearance. And you can see that that's what was done or proposed here in their first study by Rodrigo and colleagues in 2014, that was then subsequently been built on in further publications. In people and now similarly in dogs, generally they're grouped according to the appearance. So you have either a failure of vertebral segmentation in portions of adjacent vertebral elements that don't divide, and therefore you have the block type vertebra, or you have a failure of vertebral formation in which the portion or element of the vertebra is malformed or deficient there, and therefore you end up with these wedge-shaped or hemivertebral or butterfly vertebra. There are also a few other subtypes which are categorized, including transitional vertebra, types of spina bifida, and also the caudal articular process dysplasia, which we know happens more commonly within the pug breed. Within this study in particular, they identified that these malformations were very common within the thoracic vertebral column of these brachycephalic screw-tail breeds. And they identified malformations in up to 23.5% of vertebra that they analysed. And in fact, they found that 2/3 of the dogs within this study had more than one vertebral malformation. They identified that less severe vertebral defects, such as the ventral median aplasia or butterfly vertebra, or the ventral hyperplasia of the vertebral body, were less commonly associated with neurological deficits, whilst the more severe vertebral malformations, including the aplasia of the ventral or ventrolateral aspects of the vertebral body, the dorsal, essential dorsolateral hemivertebra, were more likely to be associated with concurrent neurological deficits. What we do know, though, however, despite their increasing incidence or prevalence, we know that vertebral malformations are actually commonly incidental findings, and numerous publications have built upon this subject. As you can see here, the results taken from the paper within the bottom right there of the screen. We know that one or more hemivertebra are identified in the vast majority of neurologically normal, i.e. those without neurological deficits, French bulldogs, and also 3/4 of English bulldogs will have these malformations without having any neurological signs or seemingly consequences. So then what is the clinical relevance of hemivertebra. So although we should really only regard them as a primary cause of neurological signs kind of very rarely, their presence has been associated with, as you can see, altered gait variables, and identified in potentially contributing factors to the development of a number of other conditions. So as we can see from these studies that I've listed here, congenital vertebral malformations have been associated with the early or premature degeneration of intervertebral discs adjacent to the malformation or site of kyphosis. A greater than 2 times odds of development of a thoracolumbar intervertebral disc extrusion. And additionally, when we do see these extrusions, they tend to be in a more caudal or lumbar location comparative to the malformations, which are more commonly within the caudal thoracic region. So moving on to the study that we're here to discuss. So our objectives were pretty straightforward. So we wanted to report the prevalence of discospondylitis in both French and English bulldogs, and also to investigate for evidence of an association between discospondylitis and congenital vertebral body malformation. This was based on our feeling from clinics, really, that we tended to see a higher prevalence of discospondylitis we felt within these breeds. And that wasn't the main hypothesis for our study, really, was that we felt that there was a predisposition of the breeds, and also we hypothesized that there would be an increased occurrence of discospondylitis in disc spaces adjacent to a congenital vertebral malformation. So broadly, the methods, essentially the medical databases of both the small animal teaching hospitals of the Royal Veterinary College and the University of Liverpool were searched, and we collected the data from dogs diagnosed between June 2010 and June 2020 with discospondylitis. To be included, cases had to have a radiographic diagnosis via CT or MRI, and that was based upon the previous literature of the clinical findings in both imaging modalities with discospondylitis. They had to have complete medical records as well, so that we could collect an adequate amount of data. All dogs had undergone a neurological examination, either performed by a board certified neurologist or by a neurology resident under the direct supervision of a neurologist. The diagnostic tests performed with each patient were decided by the overseeing neurologist, and were performed on a case-by-case basis. These tests could include general blood tests, infectious disease serology, blood and or urine culture, and or needle aspirates of the affected intervertebral discs. However, because this was a retrospective study, there wasn't a set list of diagnostics that had to be performed in each patient, apart from obviously the radiographically confirmed diagnosis. Information collected from each record included the location of discospondylitis, the presence and the type of congenital vertebral body malformations that we could identify, and also the site of maximal kyphosis, which was subjectively analysed from the imaging that we had available. Looking at the results, so in total, as you can see, we had 108 dogs diagnosed with discospondylitis within the study period, with a total of 118 intervertebral discs affected within those dogs. As you can see, their discospondylitis was diagnosed within 13 French bulldogs, and that was out of a total of 2,690 French bulldogs that presented to both institutions during the study window. So this led to a prevalence figure of about 0.4%. Similar story within the English bulldog. So there were 8 diagnosed with discospondylitis in that time period out of about 1,300. And we had 87 dogs of any other breed diagnosed during that time out of about 74,000 cases, with a prevalence figure of 0.12%. Of the other breeds diagnosed, 11 were crossbreeds, another 11 were Labradors, 10 Springer Spaniels, 9 Boxers, and 4 Staffordshire Bull Terriers were the most prominent breeds. And this is largely consistent with the pre-existing literature of large breed dogs being more predisposed to this condition. Interestingly, although they're not a screw-tailed brachycephalic dog, no pugs were diagnosed with discospondylitis within the study window. So, as we said, in total, there were 118 intervertebral discs affected. The majority of dogs, so 101, had a single intervertebral disc affected, whereas there were 2 intervertebral discs in 2 French bulldogs and also 2 other breed dogs, and 3 intervertebral discs were identified as being affected within 1 of the English bulldogs and also within 2 of the other breed dogs. As you can see, consistent with the results of the study we were discussing previously, we noticed that the vast majority of French bulldogs had at least 1 or more malformations present within their vertebral column, and 3/4 of English bulldogs again also had, of those affected, had at least 1 congenital vertebral malformation present. So looking more closely at the prevalence data, as you can see, we found that there was a much higher prevalence of discospondylitis within both the English and French bulldogs compared to the other breed dog population, being 3.1 times higher in French bulldogs and 4.3 times higher in English bulldogs. As you can see, that reached a very significant level of statistical significance in terms of p-value. Looking closely at which intervertebral discs were affected, so as you can see, most commonly the lumbosacral region was affected. So this was most commonly L7S1. There was 1 other breed dog that had transitional L8 vertebra. So in 1 case, it was L8S1 that was affected. Interestingly, you can also see on the table on the right that we did seem to have a large number of French bull, a significant number of the French bulldogs that were affected within the thoracolumbar region. So 11 of those, or 3/4 roughly, were thoracolumbar. However, this did not reach statistical significance, so we should exercise caution in interpreting any results of difference in the prevalence of different areas. Another interesting finding was there was a significant difference in the median age of diagnosis between the breeds. So median age of diagnosis was 1.1 years within French Bulldog, 1.0 years within the English Bulldog, whereas within the other breed dogs, the median was 7.3 years of age. We therefore surmise that discospondylitis should be considered a potential differential diagnosis in young, particularly brachycephalic dogs presenting with signs of spinal hyperesthesia and or myelopathy or lameness. The young age of onset of the French and English bulldogs we found to be remarkably similar to those which develop signs associated with a myelopathy, so secondary to vertebral canal stenosis, due to the presence of kyphosis and congenital vertebral malformation in these breeds. And we surmised that perhaps the difference in age of onset between the French and English bulldogs compared to the other breed dogs could be a factor of a difference in pathophysiology and the development of the condition. However, sadly, we don't have any histopathology of these dogs to try and look into this further and understand why perhaps they're affected at such a younger age compared to a lot of the other breeds that we're seeing. In terms of looking at the malformations, so as we kind of touched on earlier, greater than 1 or 1 or more congenital vertebral body malformations were identified in the majority of French bulldogs and 3/4 of English bulldogs. And however, there was only 1 other breed dog that had a transitional think L7 or L8 vertebra that were identified. So therefore, obviously, that reached a statistical level of significance to say that vertebral body malformations seem to be associated with discospondylitis within the study. Of those that were diagnosed with discospondylitis, 80% had a congenital vertebral body malformation adjacent to the location of the diagnosis within French bulldogs, and 5 English bulldogs, or 50%, were associated with an adjacent congenital vertebral malformation in the English bulldog. Interestingly, the site of maximal kyphosis wasn't always associated with the presence of discospondylitis. So about 40% of French and English bulldogs had discospondylitis at the site of the maximal kyphosis associated with the malformation, but this wasn't always the case. So looking at the congenital vertebral body malformation subtypes, so those identified at the site of discospondylitis were commonly the ventral and median aplasia, which was 8, essentially, so butterfly vertebra. This was common within English bulldogs, and ventral aplasia, creating a dorsal hemivertebra, was identified in 7 dogs and was common within French bulldogs. What we do know is these are the most common vertebral body malformations from previous studies that were identified within French and English bulldogs respectively. And therefore, I think it's important to exercise caution in overinterpreting these results and the predisposition of these vertebral body malformations and discospondylitis. It could be that the prevalence of these malformation types within both French and English bulldogs might be a more important factor, actually, rather than this being causative. So this led us to kind of, after digesting these results, think about, well, why might there be an association between bulldogs, essentially congenital vertebral body malformations, and discospondylitis? Based on we have 3 theories. The first being the potential of altered or aberrant vascularization within the vertebral body malformation itself. Is there, as a result of the formation of these vertebrae, change in their blood vessel structure, or how the blood vessels are formed, and consequently, could this lead to a change of the flow of blood, particularly maybe a decreased velocity of blood flow within the vertebra, and could this change in velocity lead to a greater chance of an infection via the hematogenous bloodstream, lodging them within the vertebra? Studies have demonstrated the presence of vascular canal dysplasia within the French and English bulldogs. However, histopathology of the vertebral body malformations within these breeds to look at the vasculature is yet to be performed. And this could be very interesting in trying to support that potential theory of the association. We know that in the presence of congenital vertebral body malformations is associated with accelerated degeneration of the intervertebral discs from both previous studies in dogs and also in people. And also in people, it's been associated with concomitant changes to the disc endplates as well. And therefore, could the accelerated degeneration of the disc and endplate associated with the presence of malformations, could that then be a predisposing factor also for the development of infection of those sites? It's something, again, that is we hypothesize, but are unable to kind of conclusively confirm. I guess lastly, as well, as we touched on earlier, we know that discospondylitis is generally recognized to occur in regions of higher motion. So could the changes that we're seeing here be associated with a greater degree of motion or instability And could that be a predisposing factor for infection to fall? Yes, the one thing that would disagree with that theory would be that we saw no pugs that were diagnosed with discospondylitis during this study period. And although pugs don't have generally the same genes as French and English bulldogs to predispose them to hemivertebra, we do know that they have other vertebral anomalies, including caudal articular dysplasia, which we've theorized could cause instability of the vertebral column. But what we haven't seen is those kind of potential instabilities resulting in discospondylitis within our study window of these two institutions. So that the absence of the instability in those patients being attributed to discospondylitis, for me, would make it less likely, perhaps, that a biomechanical aspect is the likely reason. But I'm very open to potential theories and find it interesting to discuss. Of course, like any study, we had limitations. This, as we said earlier, was a retrospective data set. Despite being multi-institutional and over a wide time period and featuring a lot of dogs within the study, we actually had a relatively small number of both French and English bulldogs diagnosed with discospondylitis. And of course, this could lead to type 2 statistical error and affect the conclusions that we draw. Although we know that discospondylitis was found to be commonly associated with an adjacent congenital vertebral malformation, the high presence of malformations within the breeds that we were looking at makes it challenging to definitively conclude a causal relationship rather than purely association. We didn't use the modified Cobb method to definitively measure any vertebral stenosis, kyphosis, within any of the dogs within the study. This is something we could have done should we wish to have a more objective measure of the kyphosis rather than assessing it and going off the imaging, the assessment of the images. As we said, there was no histopathology performed, which would be uncommon, I guess, within the diagnosis, but may have helped to support some of our theories for an underlying reason for the potential association. And sadly, case follow-up with beyond the scope of this study. However, what we don't know is, do dogs with discospondylitis associated with any malformations, does this affect their treatment outcome, prognosis, or risk of relapse? So in conclusion, what we found is prevalence of discospondylitis was approximately 3.4 times higher within French bulldogs and 4.3 times higher in English bulldogs compared with the general population. Congenital vertebral body malformations, while they are often incidental findings in a lot of neurologically normal dogs, were found to be frequently associated with discospondylitis in the study population. And very interestingly, both French and English bulldogs were significantly younger when affected with discospondylitis, with a lot of them being commonly having clinical signs or being diagnosed towards the end of their first year of life. And I think that draws us to a close. So I'd be more than happy to.
Thank you very much, Nick, for this very good presentation. We've got a few questions. I'm going to start with Luba from Romania. I put the question for you also to read it. How often do you have discospondylitis related to infection with Brucella canis in dogs? I presume you can say in this study and maybe as a whole, in other breed as well.
Yeah, there wasn't, within the study, as far as I was aware, there were no Brucella positive dogs. But I think that really summarizes what we see generally within our, where we practice, I guess. It's luckily it's not endemic within the region, but it's certainly something that's on our differential list of dogs with a travel history to locations where the disease is prevalent, and particularly cases that have, for me, multifocal discospondylitis, then often it's something that I will certainly look at testing for. So we'll often do serology for them, but yeah, not a common one for us.
So you don't routinely look for Brucella canis?
Not in a patient that doesn't have either a travel history or something which would flag for us to say so. Yeah.
Okay. While we wait for the question, Nick, maybe a few questions I may have. I understand in your study you didn't look at the duration of treatment, and I think for every clinician, that's really the $1 million question: is how long do you treat, and what do you use beyond clinical improvement as a way to know should you carry on treatment or not. And in this, so the correlation that in this breed that you look at, there's an impression that they are more difficult to treat or the same, pretty much as the
Yeah, it's not something we looked at, sadly, to know how long they were treated, or I'd love to do a follow-up actually, looking at this population and seeing whether there was any difference. Certainly the cases I primarily managed of these, which was only a handful, but my impression was that they did clinically as well as I would expect for comparative to any other breed that had discospondylitis. I've lost them to follow up, so I'm not aware of any higher risk of relapse, which of course would be possible. But the majority had treatment for generally an initial 3 months, and then if they were doing clinically okay, then it seemed that a lot of them were able to be discontinued from their treatment.
And do you recommend any test, or you just go with clinical sign and just stop and see how it goes? Or
yeah, I rightly or wrongly, I generally go for just the clinical signs and how the dog is doing clinically. I don't know about you guys and certainly your experience with the condition, but the differentiating between an active discospondylitis under treatment and chronic or secondary changes as a result of an inactive infection can be really difficult on imaging. So it's it's also a challenge of finances as well, isn't it, to do an T or MR. So I think ideally, it'd be lovely to do repeat bloods, probably including CRP and repeat imaging, but it's not something I commonly do in practice.
Good. We're going to take a couple more questions. In French is Woods-Honor decline diagnostic for spinal ataxia, and so are managed conservatively, presuming IVDD. Would this make discospondylitis case worse if treated, if they had? I'm not sure I understand.
I think I kind of understand. I guess it's a conversation I have with owners quite often, actually, because I think we're in a situation where a lot of clients at the minute can't always necessarily go for investigations and confirming whether it is a disc or a discospondylitis. So generally, though, I tend to say to clients that you'll know if it's not. Essentially, if the dog starts to improve with conservative treatment for a disc and then relapses, then that to me would say, look, there's something else that's going on here. Is that a discospondylitis? Is it a neoplasia? Is it an MUO or something similar? So I think generally the clinical improvement or lack thereof of cases would help me to differentiate a little bit. And those ones then I probably would try and suggest more to push for imaging. I think often the clinical progression of the case will help to determine what the best route is, and you'll probably get there one way or another. And realistically, if you are 2 weeks down the line of diagnosing and treating a discospondylitis that you treated initially for a disc, you're probably not going to have a great deal of an effect on the dog's outcome. You'll get there one way or another.
And I put this question from Dr. Sami from Pakistan. Obviously, the study didn't look at surgery, so difficult to get a rate. But probably the question is, did any of these cases require surgery on your? As far as
none of them did. None of them did have surgery, which is interesting. You would wonder whether there was a higher rate of cases having instability, I guess, with if you've got an infection associated with malformations, and therefore you'd wonder whether some of them would need stabilization, etc. None of them actually did within the study. All were treated medically.
Excellent. There's no more questions. Thank you so much, Nick, and Simon can have the final words.
Yeah, thanks very much, Nick. It was an excellent presentation. Thanks for your time today. Thanks also to your cat for adding in some opinion during the. I presume that was your cat.
Yeah, it's getting towards dinner time, and I think
you've locked him in the cupboard or something, but now it's time to come out. All right. But thanks to Hallmark for sponsoring this webinar, and thanks to everyone who attended. This webinar will be available on our Facebook site, on the website, and there's a podcast coming up, so look out for that and let anyone know who was unable to attend. This is the last webinar of 2024, so you now have some time to get your Christmas shopping done. We'll see you at the start of next year, 2025. So take care and see you then.
Thank you very much. Bye-bye.